people in England can book flu and COVID vaccines from today, with over 65s, those in care homes and frontline social care staff among those eligible for free jabs. But as the NHS rolls out its winter vaccination programme, there are calls for the health service to do more to support those suffering from long COVID. Now, according to the latest figures from the Office for National Statistics, which cover the period from November 2023 to March 2024, around 2 million people in England and Scotland say they are experiencing long COVID. Of those 2 million, around 1.5 million people, or 3/4, felt that their day-to-day activities were affected, while 381,000 people, around a fifth, said their ability to undertake such activities had been limited a lot. And I'm joined now in the studio by former Team GB rower Oonagh Cousins, who was forced to retire because of long COVID. Oonagh, thank you so much for coming in to talk to us about this.
Thank you very much for having me on.
You had dreams of going to the Paris Olympics, potentially Los Angeles, and that was stopped in its tracks because of long COVID. Talk to me about how it's impacted you.
Yeah, so I'm a former professional athlete of the British rowing team. I was pre-selected for the Tokyo Olympics in March 2020, but unfortunately at that time I also contracted COVID-19, which developed into pretty bad long COVID. And over the last 4 years I've experienced debilitating symptoms that have not only stopped me from rowing, but also have stopped me from living any sort of normal life. I'm fortunate enough that I have made some recovery now, and I'm working part-time at Oxford University doing social science research into long COVID, and I'm also part of the There for ME campaign team. But yeah, recovery is slow, and I'm not there yet. And I'd also highlight that despite the fact that long COVID has taken away my rowing career, I'm definitely one of the lucky ones. As you mentioned, there's nearly 400,000 people who are experiencing debilitating, life-altering symptoms. And at the severe end, people, I know people who are confined to their beds in darkened rooms, unable to tolerate light or sound. They can't even hug their loved ones, and these people are not getting better. And in some cases, people are dying.
What's the level of frustration you feel about the research and funding into long COVID? Because I know you're now involved in this area, and considering nearly 2 million people in the UK are affected, the ones that we know about, it's startling how little research and funding there is.
Yeah, basically the pandemic has exposed a massive blind spot in science and medicine, and there are similarities to the disease ME. And the diseases are different, but there's a lot of overlap in symptoms and possibly biological mechanisms too. And if you look back in history, there's many diseases that were psychologized, attributed to hysteria, and then biomedical research happened, and we understood the biological underpinnings, and treatments and tests and cures were found. Doctors were trained in this, and then that led to better delivery of care and better health outcomes. But what's happened with ME and then long COVID is that it's still being attributed to psychological causes. So we don't have good biomedical research, we don't have treatments, we don't have cure, and then we don't have a cure. And then the pandemic has come along, and we now have so many people with this disease who are just not getting better, and they need biomedical research, they need treatment in order to get their lives back.
You are part of the There for ME campaign that has been launched to raise awareness of this and understanding, because for so long the attitude towards ME hasn't been good, and for a lot of the reasons you talked about in terms of medical professionals don't quite know what to do about it because of the lack of research into it and the lack of treatment.
Yeah, for decades there's been this kind of competing hypothesis that it was had a psychological basis. That's been thoroughly debunked. Like, we know that's not true. The NICE guidelines were updated in 2021, but there's a whole generation of doctors who have been trained on this theory, basically, and it's been an obstructive influence to biomedical research happening. And so what we really need is biomedical research so that we can have tests, treatments and cures, and then train the doctors on the new biomedical research to enable them to provide appropriate care and to have better health outcomes for all of these people who are so unwell.
Because do you find that the historic attitude towards ME is also being shown towards those with long COVID?
Yeah, I think it's slightly better, because it was kind of undeniable that this virus was going around, lots of people catching this virus. It was more undeniable that these people had, there was a physical cause to the disease, but it is very mixed. There are people who go to the doctors and it's attributed to psychological causes. When this virus is coming, in the ME world, they were the first people to say there's a wave of disability coming, and these people will be told that there's nothing we can do for you, and their symptoms will be attributed to psychological causes. The ME people, they knew that this was going to happen. So yeah, I do think the response to long COVID is built on the foundations of our lack of understanding of ME.
Okay, really good to talk to you. Thank you so much for coming in to talk about this issue and highlight what is or not being done currently. I know you're part of a team trying to do what they can for all of those suffering from long COVID, living with long COVID. Really appreciate your time, Oonagh.
Thank you very much.